Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. You can see me for this episode by clicking on the See Me link in the show notes. Today, we welcome back Trina Dora. She's an internal medicine physician. Today's Kevin MD article is It's Time for Burnout to Become a Quality Metric. Trina, welcome back to the show.
Thank you.
So, Trina's been on several times. Go to kevinmd.com/podcast, search for her name and her prior episodes, hear a story. Let's jump right into this article about burnout. You think it should become a quality metric. Tell us about your article.
Well, I did a fellowship in quality improvement after I finished my residency. And so I worked in quality improvement for several years. And as you probably know, as a physician, since quality metrics have become so important, I mean, there are, entire departments
Yeah.
dedicated to making sure hospitals meet the quality metrics. So many different people have been hired specifically for these metrics. And whenever Medicare comes out with a new metric, then all of these resources get devoted to meeting it because the hospitals don't want to lose money. And so I was thinking, well, what if burnout or some way we could measure the burnout? What if that also were a quality metric? Then what kind of resources would be devoted to helping with burnout if this really were a quality metric? And then, like, how would the quality of those resources increase or improve from the resources that are available now?
Why should administrators care about physician burnout?
Right. So I think that ultimately it affects the patients. And so we are all in medicine because we felt a calling to help patients in this way. But whenever you're burned out, it's just so hard to focus. It's hard to care. You can lose some of your compassion and your empathy. And then it also can affect quality metrics. Whenever people just feel burned out and they don't feel cared for, they don't go the extra mile a lot of times, or maybe they still are really trying very hard, but they just are not in the mental place to be able to do a good job. They don't have the resources that they need to do a good job. And so I think that all of the things that hospital administrators do care about would actually improve if they started first by focusing on their physicians and medical staff.
There's a cost when it comes to replacing clinicians who leave because of burnout. Isn't that right?
I know there was a study that we had spoken to our administration about, and I believe it said it was about $1 million
Hmm.
to replace a physician. And, I'm sure it depends on type of physician and how much lost revenue there is while they are searching for another physician. And I think a lot of times what health systems do is they just add that person's work to everyone else. And then they say, well, we're still seeing patients, and so it's fine. But I don't think that they realize how adding that person's work to everyone else while they are, finding someone else is just increasing the burnout of those people who are left behind.
So, when you brought this argument up to administration saying it cost $1 million to replace a physician, did that argument resonate with them?
Yes, I would say that it did. And I would say this for all healthcare administration, that money does talk, right? And
Yeah.
so they are interested in the financial side of things. So I do think that it helps your argument for anyone listening who is wanting to, really put some financial resources into helping reduce burnout at your organization. I do think that that is an important thing to point out, because it's one thing to talk about maybe the less tangible outcomes, but I think whenever you show how much it costs to replace someone, then I think that administrators really do listen, because that is what they're trained in. They're trained to pay attention to the financials.
So, let's say you were running a medical institution, and I want to ask you, how exactly would you measure burnout? What are some of the things that you would look for? What are some of the things that you can objectively measure to track burnout?
Right. The one that I've seen used most often is the Maslach burnout inventory. It's been around a long time. And so that is what I have seen most often. There's also another one that I think would be great to measure, because I think a lot of physicians are lacking in self compassion. And so there is actually a survey by Dr. Kristen Neff on self compassion, and you could measure that. And so I think I would use the Maslach. I'd probably use the self compassion survey, just because physicians are so hard on themselves, and so I think it would be nice to see if the self-compassion improved.
Now, for those who aren't familiar with those surveys, what kind of questions do they typically ask?
In general, the Maslow burnout inventory, there's three kind of main categories, and it's basically trying to figure out, do people have a sense of accomplishment at work? Do they already feel like they have depersonalization at work? Are they already feeling like it's too much to handle? And so
Mhm.
there's several questions that kind of help figure that out. And then the self-compassion survey is just asking a lot of questions, basically trying to assess how kind you are to yourself, because again, physicians are so hard on ourselves, and I do think that that is one of the things that leads to burnout. Like, we think that we must do everything perfectly, and I'm not just talking about work, but in the rest of our life as well,
Mhm.
and we don't give ourselves a lot of grace.
Now, once an institution has this data, how can they be held accountable for poor results of this data?
Right. Well, that's what I'm arguing for, is that that would be a Medicare metric. And so, just
Mhm.
like all the other Medicare metrics, you have to submit your data to Medicare. And depending on the metric, they compare you to your peers all across the country. And they have a cutoff, and certain institutions, maybe can keep all of their money, whereas certain institutions then lose money. And so, that is what I would argue Medicare could do, is they could have institutions held financially accountable to decreasing burnout, increasing work satisfaction.
So you are a coach, and of course, you are very familiar with physician burnout. Again, speaking from the institutional level, what kind of interventions have you seen to be effective in terms of improving the metrics of physician burnout across an
Mhm.
institution?
Right. So I would say that one intervention is coaching. And there's actually been data from randomized controlled trials that have been published in recent years. The first one I remember was 2019, showing that coaching and coaching programs can reduce burnout. And I think that coaching is a great solution. Every year, more and more physicians are becoming coaches. So there's no lack of coaches that health systems across the country could contract with to work with their physicians and their medical staff.
So how can you scale up coaching? Because coaching I always envision as a one-to-one thing. And when you have a system of hundreds of physicians, how can coaching play up at that scale?
Right. And so, yes, there is an option for one to one coaching, but there's also group coaching as well. And so, I myself have been part of group coaching programs, and there's hundreds of people in the program. Or what you will find actually is that it's a lot of the same things that people bring up, over and over again. So, even if I'm not getting coached, there is someone that's talking about very similar things to what I experience in my life. And so, you can actually learn a lot from hearing other people get coached, and then you can teach people
Mhm.
a concept called self-coaching, where they can learn to examine, some of their own thoughts and figure out whether those thoughts are helpful or not. There are virtual, libraries of information where people can kind of, learn topics that are helpful. So I do think that there are ways it can be scaled beyond just the traditional one-to-one model where you spend an hour with every person.
So, share a story or a case study where maybe one of these group coaching sessions has improved the metrics of a particular institution, improved the scores on these surveys, improved patient care. Can you just share a story of how this might look like that would move the needle?
I'll give you a hypothetical example, but think about just in these last few years how burned out everyone has been because of COVID and everything that went along with that. And so people can only work to a certain point until they develop that compassion
Mhm.
fatigue, until they start to not want to go the extra mile, until they just kind of stop caring. And I think that by implementing these programs, it helps to prevent physicians from getting to that point. And so therefore all these other metrics that we talk about, reducing UTIs, reducing central line infections, reducing C. diff, or those types of things, I think you have a workforce who is more bought in, more engaged. They are in a mental space to actually think about these things and not just be trying to survive every day. I think that that's how burnout can help with those metrics. But then I think that that shouldn't be the only reason we should do it. We know that there are a lot of physicians who die by suicide every year. And so this could potentially be a way of reaching our colleagues before they get to that point or before they get worse if we had comprehensive coaching programs and comprehensive support. And like I said, and the reason I like the idea of Medicare kind of holding people accountable is that way health systems wouldn't just say, okay, let's do the pizza party and
Mhm.
that counts. They would have to come up with actual interventions that really do work.
Now, in your experience, do you feel that medical institutions and administrators are they taking burnout seriously?
I think that they do care. Sometimes I think that they don't really know what to do about it. But I do think that they do need more education on it and more of a motivation to care.
We're talking to Trina Dora. She's an internal medicine physician. Today's Kevin MD article is It's Time for Burnout to Become a Quality Metric. Trina, let's end off with some of your take home messages that you want to leave with the Kevin MD audience.
If you know how to get Medicare to pay attention to this, I would love to take this message to them. But the one thing I do want to leave people with is we do have an evidence based intervention to help reduce burnout, and that is coaching. And there are every year increasing numbers of physician coaches out there. And a lot of us, like myself, are still practicing medicine. And so we are in the trenches, just like everyone else, and we're able to use our coaching skills to help our colleagues. And I would encourage everyone to reach out and find a coach. You can find coaches in all different areas, all different price points. So, yes, coaching works. That has been shown by the evidence.
Trina, thank you so much for sharing your time and insight. And thanks again for coming back on the show.
Thank you.